Thank you, Rio, and thank you for having us back. Adrienne and I are really excited to come back and, of course, talk about SIM again and talk about a different type of an IPE experience than we've discussed in the past, and one that we don't believe that has been done previously. My name is Kimberly Whitten-Chung. I'm the Director of EMS Education at Pikes Peak State College in Colorado Springs.
Okay, and I am Adrienne Wilk. Let me just move my screen over here for you. My name is Adrienne Wilk, and I am the nurse part of this duo. And I'm just always thankful that you all welcome me with open arms to come and to share my experiences with Crazy Kim over here. So we do a lot of simulation together, and it's always fun to come and present. And yes, like Rio said in the beginning, please, when one of us is not talking, the other one will be monitoring the chat board. So if you have any questions, just feel free to shoot them in there, or at the end we can open it up to questions as well. So we look forward to hopefully an interactive presentation.
Excellent. So our objectives, we want to describe the experience of developing, implementing, and evaluating a simulation-enhanced interprofessional education activity between paramedics and political science students. So different, and I suspect different than what many of you expect when we're talking about interprofessional education. And then stated desire to incorporate an IPE as a teaching pedagogy for non-clinical simulation and increase interdisciplinary collaboration. So those are objectives for today's presentation. Thank you. All right, so advocacy. I suspect that you guys often use the term advocacy. We use it in education, we use it in the field, it's common in nursing as well, but like Adrienne and I had talked about when we were developing this IPE, clinical advocacy is common in our language, but there's a different, so the definition of advocate, right, is listed right there on your screen. So one who expresses and defends the cause of another. And so we are really comfortable being patient advocates. However, a component of being a patient advocate is also defending that patient in a political setting. It's also necessary for us, I believe, to be a political advocate for our field. And so if you look through the NAEMSE Code of Ethics, right, one of the things that we don't do well, we'll talk about this in a little bit, but is we don't, especially in EMS, I think, just as a generality, I'm speaking of major generalities because some of you probably do, but we don't get involved in legislature well. And so, which means that we don't advocate well for political causes for EMS. And so this IPE was combined both clinical advocacy and political advocacy together, which made it a very novel concept for an interdisciplinary exercise or educational opportunity.
And probably before we even go further, we should talk about why we were even interested in this, because anybody with common sense now stays out of political discussions in today's current environment. So for us to go headfirst into this was something that we did very thoughtfully and purposefully. But for me specifically, I lost my father to brain cancer several years back, and I was a nurse at the time, and I had no idea what to do afterwards as part of the grieving process. So for me, I just got involved with the National Brain Tumor Society as a legislative advocate, and I really enjoyed getting to go and kind of argue with our politicians on the things that the brain tumor community needed. And so that's kind of how I got started with political advocacy. It wasn't something going through nursing school I aspired to do, but it was something that through our family tragedy I discovered and was like, oh wow, I can really make a difference. And Kim has experience with advocacy as well, if you want to touch on that.
Sure. Yeah, I work with, in Colorado, I work with NAEMSE, our Colorado chapter, and we do a lot of advocacy within the state. And so one of the things, as I said previously, I think that we do, we have a deficit in the field on is involvement in legislature. And so in teaching the paramedic program, I think it's important to discuss with the students that we have this deficit, we've identified this deficit, and you point out, like, as a deficit, you recognize the deficit and you address the deficit. And so one of the objectives that we had, or in doing our needs assessment for this IPE, it was, the deficit is, we don't do advocacy. How can we help address in initial paramedic education, which you guys know, we don't have a ton of time in any initial EMS education to be adding new things. And so we're not going to add a load of work, but at the same time, we need to make it engaging and involving for the students, so that way the students can recognize the importance of involvement in legislature and advocacy later. And so through here, one of the ways that we can become involved in advocacy, what is through, of course, NAEMT is a nationwide way with lots of advocacy. That's that easy way to become involved with advocacy. The EMS Code of Ethics, like I mentioned earlier, is one of the statements is that we will be involved in legislature, and I think that's probably one of the number one ways that we are failing in our Code of Ethics. And I'll let Adrienne talk about Academy of Medicine.
Yeah, so the National Academy of Medicine, World Health Organization, they've said for years that all healthcare providers need to kind of mobilize and advocate, not just bedside advocacy as we call it, but political advocacy, because we're not going to progress legislation and laws for our patients, for the specific populations, or for our own professions unless we do learn how to speak that political language. So for us, we really wanted to make this known that this isn't an option. This isn't something that you leave up to the people in fancy suits to go to the state capitol or go to the U.S. Capitol and do. This is something that you, as just a regular person, regular, healthcare professional, you can do and you can make a difference with. So that was something that we wanted to shift their thinking, that this isn't really an option for us, that conditions improve for us and for our patients when we educate our lawmakers as to what it is that we need.
So this isn't really like we want you to come back and say, like, tell us what's stopping you, but more of a take a second to think about it. What is stopping you? I mean, is it time? Is it maybe I've never thought about it? Because prior to this, other than the fact that both Adrienne and I are actively involved in advocacy and legislation, we really hadn't thought about incorporating something like this into the classroom. Right. And so, and of course, like Adrienne said previously, putting politics into an EMS classroom is kind of taboo. And so, perfect time. That's so perfect, right? Like, these are things we don't discuss in our classrooms. And so you have to be very, very thoughtful in the approach in putting this into the classroom, because I don't want my students to feel like they are uncomfortable or ostracized in the classroom where they're there to learn about EMS education and taking care of our patients. And so it's really important, like, they're not coming in learning about our political views at all. That is not what this was about.
And what's interesting is I live in Tennessee. I work for a small university here just north of Nashville. And the state of Tennessee recently adopted laws that we refer to as the divisive concept laws. So for me, I teach nursing leadership, and so we talk a lot about politics and money and those sorts of things and how that all factors into healthcare. I have to have what's called a divisive concepts statement in my syllabi that says we are going to talk about political topics and how they relate to healthcare. We're going to talk about vulnerable populations and healthcare disparities. And I actually have to have a divisive concept statement in my syllabi just to cover me, that if any student feels uncomfortable during these discussions, that they know what to do about that. So we joke about it, but it really is kind of some contentious times right now, and we feel strongly that it needs to be discussed, but we're also doing so very, very carefully. But why do we do it?
Why do we do it? And so advocacy does make a difference. We've seen, like Adrienne said, she's gone personally up to discuss brain cancer laws, and brain cancer funding, and that makes a difference. We've had a lot of advocacy. I'm not sure if you guys are familiar with ketamine in Colorado, but it's kind of a hot topic. And so we've had some advocacy in Colorado through NAEMSE and a lot of our partners that has made a big difference. Advocacy helps change laws because we've got people that are at the state level or at the national level that are making these decisions that don't understand. I don't want to make broad statements, so don't interpret that as me making broad statements, but these people are making changes on, they're not experts in the field like you are experts in the field. And so they need your input to understand the decisions that are being made. Obviously, lobbying is a democratic tradition, like that. This is the foundation of our world, of our nation. And then policymakers need your expertise. I got ahead of myself.
So what do we do? What do we decide? Because we're not really good at just sitting back. We come up, we mull over things. We're like, oh, this is a problem. We should do something about it. And so we did. So Kim, you want to tell them what we did?
Absolutely. So what we ended up doing is we had a interprofessional education exercise that took our paramedic students and political science students. And together the students evaluated a bill that was in Colorado State Legislature. And looking at this bill, they had to evaluate the pros and the cons of the bill and how that would impact healthcare in Colorado. Now, this bill did not exclusively impact EMS. So this bill would have impacted all of healthcare in Colorado. And I apologize because I'm not at home in Colorado right now. I'm down in San Antonio. And so it's House Bill 1253, is that right?
Yeah, we have it coming up in like 2 or 3 slides. Yeah.
And so this bill evaluated, looking at, because as you all know, we're in critical staffing shortages across the nation for healthcare providers. So this bill evaluated allowing entrance into the healthcare fields for previously convicted people. And so the bill did not specify what those convictions would be. And so the students they got partnered up and they had to come up with arguments pro versus con for why we should support the bill and why we should not support the bill. On the other side of things, we had our political science students who were acting as our legislators that would be hosting the students to receive the information. And those political science students, their task was to understand how, if they were a Democratic representative or a Republican representative, how would their political affiliation impact the kinds of questions that they would ask the students, and also like, what kind of funding questions would they ask? What kind of things would their constituents want to know? And then they would have to have a general understanding about the bill.
And it really worked out great because we kind of thought, well, with our EMS students, do we assign them pro and then another group con? But when you look at our objectives for the students that were in this, Kim will go over those, we thought it was really important that they could think holistically about a bill and not just advocate for one side or the other. And that's why we ultimately made the decision that they had to research and advocate for, and then turn around, new scene, and do an advocacy visit against. And it turned out really well. So, Kim, you want to talk about the objectives?
Sure. And so these objectives, if you guys have sat through one of our IPE presentations before, you'll see that these objectives are different than our previous objectives, right? So they're still action oriented, right? Integrate, understand, exhibit. However, now we're looking at knowledge of healthcare policies and finance, regulatory environments, and this language is very different from initial paramedic education, but still incredibly valuable. And so, and the value of initial paramedic education for these paramedics to come out of class, even just with a general understanding of this, enriches the systems that they're going into and the patients that they're caring for. And so now we're not waiting, 2 years, 5 years, 10 years for these paramedics to understand the value of getting involved with advocacy and legislation. So second, understand the differing political attitudes, ideologies, and methodologic approaches to practicing healthcare policies. And finally, probably the most important to us was exhibit professionalism through advocacy, mutual respect, and intellectual discourse.
And they did. They did an amazing job, by the way, on that part of it.
Oh, there we go, 1098. I probably confused you with Kevin. So, in our legislature, this is a brief synopsis of the bill. So it was barriers to practice regulated professions. And so it was, like I said, an authority to practice based on a criminal history. And you can see it does not specify what that criminal history is. But it does allow a conditional license, certification, or registration that will have, assuming that they have appropriate oversight from the employer. And if you guys are familiar with the way that bills come through, the bill doesn't have the specifics. So the bill gets introduced, right, either by the House or the Senate, whoever introduces it. Then it processes it through, it gets approved, and then once it goes into law, then once it goes into rule, that's how all of the specifics start to come in. And so, so we envisioned that as the students are coming in, they're coming to talk to their legislators to say, yes, we want this bill to come through. This will benefit the system. No, that we can't have this bill to come through. It's going to be harmful. And so the way that we set this up, as I said previously, we did not spend a lot of time briefing our political science students. I reached out to a professor of political science. We had immediate buy-in from our political science colleagues, and the students were really excited about it. I gave them written information on what our expectations were, and then they went with it. Our EMS students did not know that they were going to be involved with an IPE initially. And it just so happened, very conveniently, that I participated in EMS on the Hill with an NAEMSE. And so the Wednesday before we were going to introduce the IPE to them was NAEMSE, EMS on the Hill. And so they watched me doing some of, they watched specifically my introductions and talking with our local representative as I led that on the Wednesday before we introduced the IPE. Adrienne and I introduced the IPE on Monday. And so Adrienne zooms in with us because obviously, we're not next door. And, but fortunately with Zoom, it makes the distance much shorter. And so went through the objectives. Adrienne talked about the political advocacy and we introduced the bill to them. And then we assigned their groups and were able to give them time at home and then also time in the classroom to prepare for this event.
And this is, I mean, coming from the simulation, and trying to adhere to standards side of things, it was really important for us to just not throw these students in there. Talk about psychological safety, because this is so far out of their typical wheelhouse. You throw a coding patient on the, they're much more comfortable. They would much rather do a code than this. And so we wanted to make sure it was a great learning opportunity and experience for them. So we provided them with ample preparatory time. Now they're still going to feel like, oh, I don't know what I'm doing. I've never done this before. But we wanted to make sure that we gave them as many opportunities to be successful and to feel confident, or as confident as you can, in a brand new experience. So from the psychological safety standpoint, we wanted them to feel prepped and ready to go. Plus, with that too, that would help meet that objective of mutual respect, intellectual discourse, and keeping them comfortable so that they weren't uncomfortable and we wouldn't have any kind of testy interactions, which we did, which is great. So now on to the numbers side of things, because, Kim is in her doctoral program. I was just wrapping up my doctoral program because, what do you do while in doctoral programs other than like another research study? Because why not? So we actually decided to submit an IRB at Pikes Peak State College to study this and actually survey the students and to see what it is that we did, what the effects were, and whether or not this is something that we should keep doing. So with all simulation research, Kolb's experiential learning theory was kind of the framework of what we did. Preparing them, letting them practice, kind of evaluating that practice, and then just kind of repeating that. So it's cyclical in nature, and pretty much every sim study out there is built on Kolb's experiential learning theory. What we wanted to know was just a very basic research question. Was there a statistically significant difference in student reports of political engagement or advocacy engagement before compared to after the IPE? So what we did, it was a quantitative design, so it was just a numeric survey, Likert scale. It would be great next time that we do this. So part of why we're doing this, I will put a plug in, is we want to share the cool stuff that we did, but we also want to recruit more folks to get on board and to invite anybody else that thinks this is a great idea to participate in a multi-site study, because Kim's cohort is small. It's hard to get statistical significance with a cohort of 12 students. So we're sharing this just to disseminate information, but also hopefully to recruit some folks to come join us and do this fun stuff. So it was quantitative. Maybe in the future we could get some qualitative pieces to it. We didn't really have a control group. It was just the one group. We surveyed them before and we surveyed them afterwards. So in terms of the privacy component and consenting them to the research, I did that. And Kim kind of had to stay out of it. And the reason for that is, again, politics. People are afraid to have those discussions. On the survey, we did gather students' political affiliation, their ideologies, and kind of that political readiness and activism that they may or may not have participated in. So we felt strongly that for the students to give honest answers, there couldn't be even the perception in the slightest of any type of retaliation if they maybe would have had a different ideology or belief than what Kim the instructor assigning them a grade in the course. So Kim was there for all of the pre-simulation training and education, and we did all of that. And then I was the keeper of any identifiable data. So Kim has no idea who's Republican, who's Democratic. To be honest, I have their names in a column on the spreadsheet, but it means, names mean nothing to me. But so that was really important to us because we know politics and political backgrounds are really a sensitive topic. So I did consent them. Students received their purpose, the risks and benefits to participating. There were really no risks, maybe just some discomfort and feeling uneasy during the simulation. There were no benefits. We didn't pay them to participate. All students participated in the simulation experience, whether or not they elected to participate in the research study. And then they had all of my contact information, and nobody reached out with any questions, but they had it in the event that they would have had questions. So our sample, it was conducted at Pikes Peak State College in Colorado Springs. We had 12 students in the paramedic cohort, and 9 ended up, all 12 did a portion of it, but only 9 actually completed both the post survey in its entirety. So we ended up with a sample size of 9 from EMS. And then political science, we did have 2 political science volunteers that participated. One of them did both the pre and post survey and did them in its entirety, and then one of them only did the post survey but not the pre survey, so we didn't have any comparison, so we did have to get rid of that. So we ended up with a total sample size of 10. We did require that they were at least 18 years of age to participate, and we didn't actively recruit any vulnerable populations or anything like that, but welcomed any and all students that were there to participate. So for my statisticians out there, we did do a power analysis just to kind of take into consideration what an ideal sample size would be for the study that we did. Ideally, you can see that sample size should have been around 34 folks in order to get some statistical significance with that matched t-test that we ran. But again, we knew going in we only had a cohort of 12 EMS students. So there's no way we could have gotten to that minimum sample size, but we were going through the process, and like I said, maybe we can convince a few of you out there listening to join us in a multi-site. So 9 of the students were EMS, 1 was poli-sci. The majority, 70%, were aged 18 to 29. 90% were non-Hispanic or Latino, and then 80% of the students that participated in this study were white or Caucasian. So this was pretty interesting. It was, I think, fairly evenly matched in terms of the sample political history. 40% were liberal, 30% conservative, 20% considered themselves libertarian. Again, on the party, 30% libertarian and other, which was interesting. They didn't really indicate what the other was, so maybe that's something we can explore in a future study. All of them were registered to vote, and all of them had voted in the last election, which I thought was really cool. I was not expecting that at all. When we did this with my nursing students, nowhere nearly as engaged as what your EMS students were. So I think that's pretty cool. So we asked a couple of things. In the last 6 months, have you shared or made a social media post that was politically related? Most of them hadn't, 60% hadn't. Had they Googled any politicians or political groups? 70% had. Had they engaged in any type of political advocacy? And 80% said no, which is interesting because they had just gone and observed that EMS on the Hill. So maybe they just thought observing wasn't actually engaging in it. It was a 50-50 split on signing a petition. So I don't know if that was a part of their course or, but a politically affiliated petition, half of them had participated in that. Had they protested or marched? 30% had, which again, I was pretty impressed by that, but 7 of them hadn't. And then 80% said, nope, we did not donate any money to a politically affiliated group in the last 6 months, but 2 had. So again, I was kind of surprised by that. So The way that we determined the effectiveness or what the outcome of our research question was we created our own political engagement survey. There really isn't anything out there, especially not for healthcare professions, that we could have used a valid and reliable tool that was already in existence. So it was a homegrown tool. It had 10 items on it, and we gave it pre and post IPE. And then afterwards, to evaluate the simulation experience itself, not just how determined they were to participate in politics, but how did the sim experience go, we did get to use a valid and reliable tool. There's lots of tools out there in the sim world. So we decided to use the Educational Practices Questionnaire. It's a little less clinical in nature. Some of the sim surveys that we use, they're very specific questions about disease processes and medications. So this one is a little bit more generalized to the simulation design and its execution and evaluation, not just clinical stuff. So we gave this after the sim experience, and again, we had really good results, which I'll share in a minute. So just to quickly go over, what did those 10 items ask in that political engagement survey? So we asked our students, do they enjoy engaging in discussions about politics? Do they understand how to become involved in advocacy? Are they knowledgeable about pending legislation that affects healthcare? Do they think political advocacy makes a difference? Do they intend to vote? And then kind of back to some of those initial questions. Do you intend to create or share a social media post, to Google, to sign a petition, to protest or rally, or to donate money? So our homegrown tool, again, 10 participants in our sample, so we didn't have a whole lot to go off of to determine reliability. But I do have the Chromebox Alphas there for anybody who enjoys stats. Again, a larger sample size would help to increase that. The reliability of our Educational Practices Questionnaire, though, was spot on. So how did we do? So coming up, what I did here, I have those 10 questions from the political engagement survey that we did. You can see the pre-IPE survey column, the post-IPE survey column, and then the significance is all the way to the right. The means that are highlighted in yellow show an increase between pre and post-IPE. The green highlight, that shows the ones that were statistically significant. So again, we were very hopeful. 7 out of the 10 items on that engagement survey did increase from before the IPE to after the IPE. Only 2 of them were statistically significant, but if we can get future studies out there, multi-site, that would be super helpful to grow this and hopefully get better statistical significance in future studies. In terms of our Educational Practices Questionnaire, you can see this was a Likert scale from 1 being not good to 5 being excellent, above average. And you can see the means are all above 4, except for the 1, which is interesting. So we'll see. Instructor communicated goals. So again, as Kim mentioned, we had several meetings and informational sessions with them, telling them very clearly what the goals were, how to do it. I actually did a sample kind of site visit and showed them, well, when I go to advocate for this piece of legislation for the brain cancer community, this is how I do a site visit. So it could just be we didn't do it in the way that they would have liked. It would be interesting to drill down. Or it could be this is just so far out of their wheelhouse, they felt like a fish out of water, and even though we were telling them, it wasn't quite, they weren't digesting it because it was something so new. But it definitely gave us some pause, and we'll think about that for the next time we do this, and maybe go back to those students that did participate and say, hey, any suggestions that you have for how to maybe better prepare students in the future, we're all ears. But again, that qualitative component may have come in handy had we done a mixed methods. So in terms of what do we think this means from the education and research part, I mean, it broadens the scope of simulation enhanced IPEs. Sim IPE doesn't just have to be that handoff from healthcare provider to healthcare provider, where you're wearing gloves and doing patient care. It broadens that. There are so many opportunities for collaborating with other disciplines that they may not be a healthcare discipline in the traditional sense, but they still play a role in healthcare that we provide and in the work environment that we have. And then I'll talk about research, and Kim can have practice. There's nothing out there. I mean, Kim, I think you tried to do your dissertation on this topic, and there's nothing out there. I mean, there was nothing to even form her dissertation on. So we're hoping that by inviting you all to participate with us, that we can really get some good data, publish it, put it out there, and this be kind of a jumping point for somebody who really has this as an area of interest, that this can become their future program of research. Okay.
Yeah, and just to piggyback off of that, I tried to do my dissertation on paramedic participation in interprofessional education, and I couldn't because there wasn't enough research on paramedic participation in IPE. And so now we're in such a small subset of IPE that's so novel that there's definitely nothing out there on that. And so for people to become, to get involved in this and invested and start doing things for their programs and their professions will really help push the profession forward. And then study implications for practice. Like we were talking about, we have people making decisions that are not necessarily subject matter experts. And so we advocate to reduce disparities. And we have vulnerable populations that are impacted by the decisions that are made. And you are the subject matter experts, and we are educating new subject matter experts. And so we need to be able to start early with our students to make sure that they know that this is an important role with what they need to be doing. This is part of patient care.
Absolutely. And so with our study, I mean, obviously we're looking back, we've kind of talked about the small sample size as being the limitation to the generalizability of our results. But it was still a pretty homogenous group. 80% were Caucasian. So we're hoping by opening up to different sites that maybe it's not quite so homogenous. Just because this was kind of a last minute addition, because some of our best ideas were like, yeah, let's do it. Well, the semester started. So Kim had control of her curriculum and being able to add it in. But because the semester had already started, we did have to seek out volunteers from political science, and it wasn't a part of their curriculum. And so we thought, to sweeten the deal, well, instead of in-person on-ground visits, lobbying visits, we did it over Zoom, which was kind of nice because as the facilitators, we were on the call, but we could kind of hide ourselves, mute our video, and we weren't hovering, whereas if it was on ground, maybe we would have been hovering and interjecting more. But it would be interesting to differentiate on ground versus electronically on Zoom. Did that make a difference? Was it more nerve-wracking, less nerve-wracking? It would have been interesting to see what our students had to say about that. And then what we could improve for next round. I think figuring out what it is that they maybe would have felt more comfortable with the goals. Even if it was just Kim and I kind of doing our own mock site visit and recording it and giving that to them. We even thought about, they had class time to prepare within their groups. We encouraged them to keep it more like a discussion and less like, well, I'm going to talk about statistics and I'm going to talk about this. And so they did well, but maybe they would have liked more time, or to run it by us, that as faculty we could give them some pointers. But again, we would definitely explore that more. Any other do-overs, if you could, Kim, for next round, our lessons
No,
learned?
I agree. I think the in person with the political science students, if we could, I think that would make a big difference. It was really beneficial. That I think the conversations were really rich, and I think both sides of the students really learned a lot from each other. But there's just that value to being in person.
Yes, absolutely. So I think that's it for us. I'm going to open it up for questions, but just so that we get this on the recording, this is our contact information before I stop sharing my screen. If you have any questions, we are more than willing to answer them again, or if you want to be a second site for us, please give us a shout. We'd be happy to have you. So I guess now I will stop sharing and we will take questions, if anyone has any. Give it a minute in case anybody's typing.
I was surprised we didn't have questions along the way. That was neat.
People are scared to talk. It's politics. That's fine.
We're like our students. They're like, wait, what are we doing?
Right. Oh, somebody asked, would I be willing to share my divisive concepts statement? Yes. So absolutely, I can put that in there. Just email me and I will copy and paste it from my syllabus. I'll put that out there. I'll copy and paste it from my syllabus and share that with you. It was something that my university came up, kind of shot it out to all of us just to protect our ability to have those conversations. So I would be more than happy to share that. And then, yeah.
Not much legislation in Indiana, but I think it would be good to have. Oh, sure.
Yeah.
And I think you're right. It's not a bad idea to just have yourself covered. Better to be proactive than reactive.
Right, right. Okay.
What else do we have? Do you find yourself in a slippery slope when discussing topics in regards to anything political?
Yes and no. I mean, it's hard when the beauty of the bill. Let me start with the beauty of the bill that we selected was co-sponsored by Republicans and Democrats. So I would encourage you, if you're going to incorporate this into your curriculum, find an apolitical bill that is co-sponsored by differing political parties, because then that kind of keeps you out of hot water. And when I gave examples or when I would talk, I would say, well, if I was a Republican, I would say this, or if I was a Democrat, I would say this. So I was mindful to give examples from both sides of the aisle, and really just to check myself and what my beliefs were, or my political background, and just to keep that out of it. And so it wasn't too hard for me to do that, because that's one of the things with lobbying for other organizations. They're like, this is apolitical. You are here to talk about how they can help the brain tumor community. You're not here to talk about your politics. So that's kind of been conditioned in me. So it wasn't too hard for me. Kim?
I agree. I think that's, you are there to get a message across. You're not there about politics. And so when you go in with that mindset, it's kind of the same thing with your patient care. You're going in with the mindset of it doesn't, I'm going to treat you as a patient. There's none of the other stuff matters. And so, and that's one of the things we want the students to model as well. We want them going in saying, everything else is stripped off. Nothing else matters. And so, and it's good for them to see you model that.
Mm-hmm. And that's why we told them, we listed our objectives in order of importance. And yes, we wanted them to know the policy and the bill number and all of that, but we wanted them to understand where both sides of the aisle might come from, in their arguments, either for or against it, and then most importantly, just to be professional in their communication, which they weren't.
And one of the reasons that we really wanted them to know, like, what is a Democrat going to ask and what is a Republican going to ask, is because they need to know how to prepare to go into those offices, because they might have to prepare different presentations. Yeah. And so this way they're going in and they have this information ready for this legislator and this information ready for this legislator, which helps them be prepared better for everybody.
Yeah. No, great questions.
Yeah.
Give it another few seconds, see if anybody has some. So we've answered the questions that we received so far, which are great. And you have our email. So again, to participate, work made by administrative. I mean, it doesn't have to be specifically related to the medical field. I mean, if you can find a way to incorporate anybody that might have a hand in the outcomes for our patients, and it meets the objectives, because everything goes back to your simulation objectives. If it meets your simulation objectives and would maintain psychological safety, and you can adequately prepare everyone, it's harder to prepare when the bigger you get. But I would say, yeah, the more the merrier. We need all the help we can get.
And it's always good to have those people in those conversations. And we're happy to have those conversations with you. So if you have this idea, we are happy to have that conversation with you to help you kind of wrap your head around, like, how can I get this together, right? Because it starts with the needs assessment, then you're going to put together your objectives, and then you're going to start getting everybody down and developing what you have.
Great.
Oh, Sherry, I love that. I love that you guys do that. Sherry says they're advocates. She's gonna present it to her ops manager, and that's right. This doesn't have to be initial education, and so IPE doesn't stop at initial education, right? Like, this is an ongoing process, because we're all lifelong learners.
Right. Absolutely. And then the question: is it okay to do pool participation? I'm assuming you're just like asking, for volunteers outside. Yeah, absolutely. And Kim and I even talked about, she has a much larger student body in her EMT program. So we're thinking about opening it up to that, because I mean, as far as educational preparation, EMT, paramedic, I feel like everybody's on an even playing field in terms of background knowledge coming into this. It would be different depending on if it was clinical content possibly, but yeah, I think we're all pretty much on an even playing field, that we can open it up to some other titles or within the profession. Great. All right. Well, I think we are almost at our time. Yes, looks like Rio's posting hers there. So if you all don't have any other questions.
Thank you, everyone. Thanks for the great questions. Those were fantastic.
Rio will